Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our content and courses at sptwithme.com. Now, for what you're actually here for, let's talk about contralateral inferior quadrantanopia. To learn about this topic and really understand it, you have to know about the visual pathway. So let's talk about it. This image shows a top-down view of the visual pathway. We have our eyeballs. We make our way towards the back of the head, and we start with the optic nerves. Then we reach the optic chiasm. This is going to turn into what is called the optic tract, which then sends information to the lateral geniculate nucleus, aka the LGN, that is in the thalamus. After that, we have optic radiations that send information from the LGN to the primary visual cortex, which is where all the afferent visual information is then processed. It's a purely afferent pathway. Nothing motor is happening at all. Notice that each eyeball has two tracks. If we look at the left eyeball, you'll see there's a blue line and a red line. Same thing with the right eyeball, blue line, red line. You'll see that for both eyeballs, the blue line is on the left side of it, while the red line is on the right side of each respective eyeball. Now, look at the left side of each eyeball, or the blue side. Look at what information is received. What is received is visual information from the contralateral side. So the left side of each eyeball is going to receive right-sided visual field information, while the right side of each eyeball is going to receive information about the left visual field. Now, we're going to follow the blue and red lines of both eyes to where it becomes the optic nerve, making its way toward the back of the brain, and we're going to eventually reach the optic chiasm. This is the junction that kind of looks like an X, and it looks kind of confusing because there seems to be a lot of crossing over. But in reality, it's actually not that confusing, so we're going to break it down. Look at the two blue lines starting from the eyes. You'll see that the two blue lines, even though they were on different eyes, they both end up going to the left side of the brain. They both get to the LGN on the left side of the brain. Same thing with the red lines, or the right side of each eye. Both red lines end up making their way to the right side, reaching the right LGN. So when you break it down, you will see that of the total of 4 lines, only 2 of them actually cross over at the optic chiasm. And the 2 that cross over are the ones in the middle. So the right side of the left eye and the left side of the right eye. Just to go over it one more time in a different way. If you look at the left eye and follow the blue line, so the left side of the left eye, you'll see that this stays on the left side until it reaches the brain. If you look at the right eye and look at the blue line, so the left side of the right eye, this line has to cross over the optic chiasm to reach the left side of the brain. Look at the right side of the left eye. You'll see the red line. This has to cross over to reach the right side of the right brain. But the right side of the right eye, the red line, this one does not need to cross over the optic chiasm because it's already on the right side. So blue, aka left side of each eye, is going to make its way to the left, while right, aka the right side, or red, aka the right side of each eye, is going to stay on the right side of the brain. Once it reaches the LGN, this is where the information is sent to the primary visual cortex through what is known as the optic radiations. This is a really great image showing you the three-dimensional nature of the optic radiations. So there are 2 optic radiations, one that curves upward, aka the superior optic radiation, and one that curves downwards. This one is known as the inferior optic radiation, but it has another name, the Myers loop. So the reason it's important to know about the superior and inferior radiations is that they actually have different jobs. So until now, we've only talked about the left and right visual field. However, once we get to this region of the visual pathway, so the superior and inferior optic radiations, this is where we start to integrate some more complexity into our vision, because the superior optic radiation is going to provide information of the inferior portion of our visual field, and the inferior optic radiation, or the Myers loop, is going to provide information of the superior visual field. So now we can divide vision into quadrants: left, right, up, down, superior, inferior. Now it's time to get into what an inferior contralateral quadrantanopia is. So when you look at this image, you will see that the inferior contralateral quadrantanopia occurs when there is a defect or some sort of damage to the superior specific optic radiation. This is obviously a 2-dimensional schematic, so let's just say number 5 is representative of a lesion to the superior optic radiation, not the inferior optic radiation. This condition can occur if there's a defect at any point along the superior optic radiation. So if it's at the very beginning, if it's at the middle of it, or if it's at the very end of it. Let's take a look at this schematic of how a patient would essentially see the world in their perspective if they have inferior contralateral quadrantanopia. The pink suggests that it's a blind spot, so your patient can't see anything here, while the white suggests that you can actually see something. This is exactly how a person would present. A person would not be able to see the inferior left field of view. So let's break it down as to why. Well, the right side is affected in this image. What field of view does the right side see? It's the left field of view. So it should make sense why the left field of view is affected. Now let's talk about why it's the bottom versus the top that's affected. In here, in this image, our superior optic radiation provides information about the inferior visual field. So if it's damaged, the superior optic radiation is damaged, then the inferior field of view is not going to be visible because it's damaged. So what we have is an overlap between the left side of our vision being affected and the inferior aspect being affected. Well, if it overlaps, the only thing that overlaps is left inferior visual field. And that's exactly why they cannot see here. So what you would expect to see is that if you're having your patient do a visual field test, they would be able to see everything except the inferior left portion of the visual field in both eyes. If you enjoy content being taught this way and you're studying for the NPTE, check out our courses at sptwithme.com. Look into these references for more information.